everyone, my name is Khan and I'm a third-year optometry student. If you're new here, hi! I make optometry, pre-optometry, educational, and lifestyle videos. So if that's something you're interested in, go ahead and subscribe, leave the notification bell on, and connect with me on Instagram. So today's video is going to be me sharing why I chose optometry. And I guess ever since I started my YouTube channel and Instagram, that's been the #1 question that I've been asked, and it's something that I felt really personal to me, so I never felt the need to share it, but I realized that it's something that could help others out when they're deciding on what career to choose. So I guess it's like the perfect time for me to be sharing my story. And I want to brag about my profession, my amazing profession that I chose. This isn't going to be the stereotypical why I chose it because I want to help others type of videos. You know, I actually want to give you guys a glimpse of my personal statement, the reason why I chose the field of optometry, how I got there, and why the field of optometry is amazing. So yeah, let's go ahead and get started. So a glimpse of my personal statement. You know, in my senior year of high school, we did a clinical rotations program at Methodist Hospital where we were allowed to shadow different healthcare professionals. I particularly loved private practice and primary care offices the most because I love the close-knit environment, and I've always been fascinated by primary care because you're the first line of defense for everything. One of the things I noticed the most was that you get to watch your patients grow up. So when I was shadowing the pediatrician or when I was shadowing the optometrist, they would say things like, oh my gosh, how's your wife, how's your kid, and stuff like that. And I really want to be that family doctor. And optometry never failed to keep my interest when I started college. I got my first job as an optometric assistant, where I initially honestly fell in love with witnessing the relationship that the optometrists build with their patients. I definitely recognize the time, the care, and attention that they provide to every single one of their patient. You know, you're in there with your optometrist for about 15 minutes to sometimes an hour, and the relationship that you build during that time is amazing. And that was one of the solidifying factors for me because I can see myself doing that. Why I love optometry is that it focuses on such an integral organ of your body. You know, the eye is the only organ that doctors can directly visualize blood vessels. And you know, looking at the back of your eye, looking at your retina, it can tell so many things and help detect so many systemic diseases such as hypertension, diabetes, RA, MS, and so much more. And you know, by just checking your optic nerve, extraocular muscles, it can detect changes in your central nervous system. Me checking your pupils, I can determine if you have an APD, which could be a sign for a tumor, optic nerve damage, and severe glaucoma, and honestly so much more. So it's amazing how one little organ can show us so much. And that is just posterior seg. There's so much more in the anterior seg that we can diagnose, you know, like herpes, chlamydia. And you know, you come in with an ulcer, you're experiencing a lot of pain, you're experiencing a lot of redness, dryness, and all of those things. With optometry, there's such a gratifying results. You can get instant gratifying results right away by, you know, giving your patient a new prescription and new contacts, or they come in with foreign body sensation, remove it, give them some drops, and you know, they're feeling great. And with that being said, there's also slow but gratifying results, you know, for patients. If you're monitoring their diabetic retinopathy, you know, if you're monitoring a glaucoma patient, you know, that they have uveitis, bacterial, viral infections, and all of that stuff. And honestly, the cutest, slow, and gratifying result would be vision therapy for little kiddos. I think it's so adorable. I remember when I worked at the eye clinic, we had a little boy and he was 8 years old, and his family came in for a regular eye exam, but you know, as they were talking, we realized that he was doing really poorly in school. He wasn't paying attention in class, he doesn't want to do homework like ever. And then when we did test on him, we found out that he had a binocular issue where he wasn't able to converge at near, and every single time he tries to sustain a near working distance, he would get headaches, and that's why he doesn't want to do homework. And so we put him through a few weeks of vision therapy, about 8 to 12 weeks. And then when he graduated from the vision therapy program, we gave him a little graduation cap. And then when we see him again in the future, you know, he was doing his homework. He was able to do all these things and sustain a near working environment that he wasn't before. So I guess one of the cutest, slow and gratifying result would be watching a kid go through vision therapy. That's adorable. But also, you know, optometry is such like a well-versed field. We have so many different specialties now. You know, there's low vision, sports rehab, ocular disease, contact lens, which is the money getter, and honestly so much more. And the lifestyle and work environment, like I said earlier, I really loved the environment that you work in. It's very close-knit, but also you can have either a private practice or you can work at a hospital, the military, VA, medical center, and just other healthcare providers, or if you're interested in research, that's also something that you can look into. But another environmental factor would just be having a really clean environment. You know, there's no body fluid, no blood, thank God, no pacing individuals. It's just a very relaxed, I'm seeing my patient, I'm seeing the next patient, we're going one out, you know, so it's very chill, and I love that. Speaking of lifestyle, it is a 9 to 5, which is honestly amazing. And you get flexible hours, great salary. It's honestly such a great profession to have like side hobbies with, such as I'm hoping I can continue this YouTube channel in the future and continue my social media, my Instagram. And I want to leave you with the new advances that are coming out, you know. Because of COVID, everyone's shifting, all medical fields are shifting towards telemedicine, and I think it's amazing that optometry jumped into there. So that's going to be really exciting for us, and there's so many new contact lenses coming out, you know, there's one that you can measure your intraocular pressure by just taking a selfie. So that's really cool. And you know, there's different specialty contact lens coming out as well. And there are, you know, new machines to take pictures of the back of your eye. There's new dry eye treatments, and there's honestly so much of everything. So I'm really excited to see how the future of optometry would go. But right now, I'm loving it. And I hope this video inspired you a little bit and give you a little glimpse of the field of optometry, because my biggest pet peeve is when people say, you're an optometrist, you're an optometry student, do you just do 1 or 2? And there's just so much that I just listed, and there's so much that goes on behind optometry, and I really want to debunk the stereotype that we just do 1 and 2, because that is correct. You know, we do correct your refractive error, but I mean, there's so much more ocular health that goes into it. So yeah, as you can tell, I'm a little passionate about my field, and I hope I made you passionate about the field as well. Go ahead and like this video, thumbs up, and let me know in the comments below what you thought about the field of optometry, or if this changed your views on everything that we do as a profession. But I'm gonna go ahead and go. I hope you enjoyed the video, and I'll see you next time. Bye guys!